CBT in 2020 is still considered to be the gold standard in the management and treatment of anxiety, depression, and anger that can cause so many problems in our lives, in our relationships, in our careers, in our studies, and in our health. CBT is based on the belief that what we think determines how we feel, determines ultimately what we do. CBT believes that when difficult situations occur, even if they happen incredibly quickly, they always follow the 5 sequential steps of a difficult situation, creating an automatic thought from us of some kind, leading to a physical experience of some kind, an emotional experience, and then ultimately a reaction or response from us. Difficult situations that we can otherwise quite easily figure ourselves out from become triggers when something is happening in the current time that is somehow thematically similar to a past event or experience in our life that we have not completely resolved. When that happens, the brain recognizes it, either consciously, and then we get a literal thought such as, this is just like when so-and-so did such and such, or it registers unconsciously. Either way, the brain recognizes that something is occurring that is somehow extra troubling to us because of our past, and it goes into fear-driven mode. Brain overestimates the size of the outside threat, and it begins to believe that it needs to help the body contend with what it thinks is this big outside threat. And when it does that, it pushes chemicals throughout our body to give us the energy that the brain believes we need to contend with this outside threat. But because it's oversized the problem, the help is too much. And so that thrust of chemicals that is supposed to be protecting us overprotects us. And 3 things change. We will get a thrust of negative thoughts. We will get unpleasant physical symptoms and experiences, and we will get a thrust of negative emotions. That those 3 things combined will drain our energy, and there simply won't be enough energy left over for us to be consciously responding to the problem, and it throws us into fight or flight mode. The goal of CBT is to buy back that energy so we can put ourselves back into a conscious response mode. So let's look at the first thing, the difficult situations. The bottom line is that none of us really have complete control over the difficult situations that happen in our life. We can sometimes reduce our exposure to problems and problematic situations by virtue of deciding who we're in relationships with, who we're living with, and who we're working with. But even then, we don't have complete control, because the bottom line is that every day things will happen that we didn't want, didn't like, and didn't expect, some days bigger than others. So if this is a sequential process and we don't have complete control over the first stage, which is that trigger situation, then let's go to the second stage, which is our automatic thinking. And that's what CBT is all about. The belief is that if we're not drinking, drugging, or delusional, we have the capacity, with practice, to interrupt the negative thoughts that we're having so that we can have the situation play out differently. What we learn from a good CBT program that should be personalized to your unique reactions and situations is to be able to identify that we are in fact in the midst of a trigger reaction, how to immediately remove ourselves from the stressor that we are finding ourselves in, learning ways to either distract, discharge, or soothe our immediate physical and emotional reactions that we're having, and be able to anchor our thinking by giving ourselves a present-specific fact of the situation we find ourselves in, identify what is truly most important to us in that situation, and then to put ourselves back in the driver's seat by identifying what our conscious response is, either by making a good decision or by having some clear, calm, direct communication, by letting the other person who may be in the situation with us what we're feeling and what we need. CBT is a method of self-awareness and a method of self-discipline, recognizing that we're in that trigger state and having the discipline to control our thoughts and alter them in a way that is going to allow us to be more objective, to be able to identify our goal, and to be able to set us in a course of responses that are ultimately going to get us closer to what we really want. So if you find yourself troubled with depression or anger or anxiety, find a therapist who is qualified to provide the CBT program that is personalized to your own lives and your own reactions so that you can begin to be back in the driver's seat in your life. Thanks for listening.